So do you think Gordon Ramsay's had plastic surgery? Listen to this video for my opinion. Gordon Ramsay is one of the world's most celebrated and successful chefs, and he's looked a little older in his younger years. He has admitted doing fillers and lasers, however he hasn't admitted to doing any surgery. His recent look has made people speculate that he's probably had some surgery because he looks so different than he did before. In this video, I'm going to talk about some of the changes that his face has gone through over the years, so you can make your own decision of whether you think he's had surgery or not, and my opinion about what procedures he's had done. This is Dr. Shim Ching. I'm board certified plastic surgeon. I work in Honolulu, Hawaii. I also work in the Middle East in Doha and Dubai, where I visit every 3 or 4 months or so. I have one of the busiest practices in the United States. I've trained all over the world, including Canada, the US, Europe, Asia, and South America. So I feel very qualified to talk to you about plastic surgery and any other sort of aesthetic medicine. So when you look at Gordon's face 20 years ago, you can see that he's already getting some lines on his forehead and some very atypical lines on his chin. He has very deep nasolabial folds, and all these lines are very common in patients that are older, but he's had them somewhat prematurely. These kind of lines really age somebody, and they're not present in younger individuals, so that's why when you look at somebody like this, you feel that they are older than they are if they have these lines already. These very distinctive chin lines that he used to have seem to be gone recently in these photos. Some of it is lighting. The lighting is a lot brighter in the photos that we're seeing, but you can see that the chin lines are much softer, as well as the nasolabial folds, as well as the lines in his forehead. Just overall, he seems refreshed and looking more youthful. I do think the lines in his forehead are probably a result of regular Botox. I think you can soften some of those lines with laser. Usually it's not a surgical thing that we do to soften those lines in somebody like Gordon. We don't like to do, for example, brow lifts in most men because lifting the brow really feminizes the face. I think one important thing to note in these before and afters that we're showing you is that the work that's been done has been nice work. It's somewhat undetectable. Even somebody like me might look at him and think, well, maybe he's had surgery, maybe it's lighting, maybe it's something else. You never really know. And that's really the trend that plastic surgery and all these aesthetic treatments are going towards. Undetectable results, natural results, results where you're kind of guessing whether they had surgery or not, which I feel are the best results possible. Especially in a man who gets a facelift, you don't want something that looks what we call feminizing, make them more female looking, or something that looks unnatural. I think with men, a subtle facelift result is going to be better than a really drastic one. And I do believe that Gordon's probably had a facelift to lift his face. Now, I feel that his face is more youthful. This nasolabial fold, this line here, is much softer. And usually you can't really achieve that kind of thing by injecting filler or lasers. Reason why is that this line is really quite deep in him. And that line is there because the face is descending. No amount of filler can really fill in that deep crevice. You can't really use lasers to lift the face. There are threads, but in my opinion, there's no way that they can lift the face as much. So my feeling is, based on the softening of this nasolabial fold, is that he's probably had some sort of facelift procedure to lift his face. It has been done very naturally, and I think this is an example of good work. Regarding the lines on his chin, which were very distinctive before, there's a couple of things that I feel could have been done there. Usually those kind of crevices are because the skin is really stuck down to the deeper layers of the face, and somebody can go in and divide that attachment to soften that wrinkle. A more drastic approach is actually to cut out that wrinkle and resuture it. I don't think that's been done because generally it leaves quite an obvious scar, and being in the center of the chin, very prominent area of the face, it's unlikely that that's been done. I think a combination of what I just talked about, release of the wrinkle, maybe some fat injection or some filler to fill in that area, and then a laser to really smooth everything over could have helped those wrinkles, and that's why they seem a lot softer now. So in summary, we like to see natural results like this in men, something that makes them look refreshed, but not different, not weird, not feminine. And I think whoever's worked on Gordon has done a very nice job at making him look better and more youthful. The other thing that I think has been done is a very conservative and very natural upper lid blepharoplasty or skin removal. I think that's opened up his eyes a bit, and that's been a nice change for him. Also done very naturally, done very well. So there you have it. This is what I think happened to Gordon. Of course, all this is just conjecture. We don't really know for sure if Gordon's had surgery, but my feeling is that he's probably had surgery. What do you think? Please give me some comments down below whether you think Gordon's had surgery or not. Please like this video, subscribe to this channel if you like more content like this, and we'll see you next time.